Hello everyone, my name is Leticia and I am your instructor for Human Anatomy Lab. So today I'm going to be talking about the different models and show you the different models that we went over in class with our friend right here. Really awesome. It's kind of weird because he's too close, but I need the model at some point, so may as well. So we actually need to name him so we can have some fun in class. But anyways, so today I'm going to be going over the models that we went over in class, and this is class section 4, which we went over soft tissue. So first of all, just like a little introduction so we can start. So soft tissue is going to be any tissue that is not calcificated. So for example, bones and teeth are calcificated, while soft tissue includes muscles, tendons, ligaments, blood vessels, skin, fat, nerves, and so on, as well as lymph nodes. So one thing that I think is important for us to talk about before talking about all of those tendons and ligaments is to be able to differentiate tendons and ligaments. So tendons, they connect muscle to bone. So always when you have a muscle, you need to have a tendon in order to attach to the bone. And then whenever we have a ligament, then the ligament connects to different bones. So one way so the tendon is named after the muscle name. So for example, the biceps brachii muscle, it's right here in the humerus, right? And the biceps brachii tendon is named after the muscle, the same name, pretty boring. However, whenever we're talking about ligaments, then we name them according to where they are located. So we have a ligament called coracoacromial ligament that is also in the shoulder joint, that it's connecting the coracoid process to the acromial process. So that's how, if we know the processes, we can tell the ligaments pretty well. And that's what we're going to see again in this video. So let's start without further ado. I want to ask you to have patience with me because this is my first time actually recording. And yeah, just please be patient so I can show you the structures. I know that that's kind of weird that he's like too close to me. But anyways, so I'm going to be moving the camera to try to figure out the best angle so I can show you. Okay, hopefully that's going to work. I may actually pause so I can organize it better. Alright, so here we have our scapula, right? Our humerus and our clavicle. So this is your shoulder joint, correct? So first thing that we need to figure out is what is anterior and what is posterior. So we know that this is anterior because we can see a flat surface, right, in the scapula. If it was posterior, then you see the spinous process, correct? So let's locate the different processes so we can name the ligaments correctly. So first of all, we know that this is anterior, we know that this is medial because this is the medial border of the scapula, and we also know that this is lateral because we have the lateral border of the scapula and also the humerus, right, which is the upper arm. So first things first, we have the glenoid cavity right here, which is where the humerus is going to be attaching to the scapula, and we also have the humerus that we talked about. We have a process called the coracoid process right here in the anterior portion of the scapula. We have the acromion process, which is right here, coming from the spinous process more towards the front. The acromion process, right? We have the clavicle right here. We also have a tubercle in the clavicle that is called the conoid tubercle, which is going to be right in this area, more medial. And we also have something called the trapezoid line right here that you cannot see, but it's going to be more lateral in comparison to the conoid tubercle. We also have something called the suprascapular notch right here of the scapula, of course. And yeah, so that's it. That's what we need to be familiar with. And we can talk about the tendons and ligaments now. So first of all, we have the glenohumeral ligament right here. So glenoid cavity and humerus, glenohumeral ligament. Now, we also have this tendon that is called the biceps brachii tendon. So this tendon right here is going to be passing through the bicipital groove that is between the greater tubercle and the lesser tubercle of the humerus. And it's important because we have the biceps brachii muscle attaching to this tendon. So we don't have this ligament here in the model, but we have a ligament that is called the transverse humeral ligament that's going to be horizontal, more in this area right here, that's going to hold the biceps brachii tendon in place. So that will be right here. So in addition to that, we have some ligaments to talk about still. So we talked about the coracoid process here. So the ligament that connects the coracoid process and the acromion process is going to be the coracoacromial ligament. Then the ligament that connects the acromial process to the clavicle is going to be the acromioclavicular ligament. We have ligaments that are connecting the coronoid process to the clavicle that are called coracoclavicular ligaments. So we have two different ones here. We have one that is called the conoid ligament and the one that is called the trapezoid ligament. And we just talked about it. This one that is more medial is called the conoid ligament because it's going to be from the coracoid process towards the conoid tubercle. And this one is also going to be from the coracoid process towards the trapezoid line in the clavicle. So again, both of them are going to be coracoclavicular ligaments, but they also have their individual names. So also we have another ligament that is going to be more towards the superior portion right here, which is called the coracohumeral ligament because it's going to be connecting the coracoid process and the humerus. So we also have a different ligament that is called transverse scapular ligament. Transverse scapular ligament. It's going to be right here. So this area is the supraspinous fossa, right? And as you guys can see here, there's this little foramen created by the ligament. And this is where, if you remember, foramen are round openings, right? So it's going to be where nerves are going to be passing through, and it's specifically the supraspinous nerve, where it's going to be innervating the supraspinous muscle and the infraspinous muscle. So again, this is going to be the transverse scapular ligament. Yeah, that's pretty much it. So let's talk about all of them very quick so you can remember. So we have the glenohumeral ligament, we have the coracoacromial ligament, we have the acromioclavicular ligament, we have two coracoclavicular ligaments right here, conoid ligament and trapezoid ligament. We have the coracohumeral ligament, we have the biceps brachii tendon, where we have the transverse humeral ligament passing through, even though we cannot see it. And then we have right here the transverse scapular ligament. So that's it for the scapula. Now we can move along to the next bone, and I will pause very quick. Okay, so we are back. So the next bone that we're going to be looking at is your pelvic bone. So that's going to be your hip joint, right? So right here, the first thing to do again is to figure out what is anterior, what is posterior, what is lateral, and what is medial, so we can figure it out where everything is, right? So here we have our pelvic bone, right? Our hip is going to be composed by two pelvic bones, but here we have one pelvic bone, and we know where is posterior and where is anterior because we talked about this, the greater sciatic notch, right? That is always posterior. So there's nothing similar to this sciatic notch. So we know that this is going to be the posterior portion, and this is going to be the anterior portion right here. And we can see as well as like the pubis here, and we can also see our femur. So again, this is going to be anterior and this is going to be posterior. So our pelvic bone is composed by three different parts, right? The ilium, which is going to be the superior portion of the pelvic bone. We also have the ischium, which is going to be the posterior and inferior portion of the pelvic bone. And then we have the pubis, which is going to be the inferior and anterior portion of the pelvic bone. So right here we have three different ligaments to be familiar with, and I'm going to show you in a different model for you to have a better idea. So here we have the same pelvic bone kind of, and we have three different ligaments to know. So the ligaments are going to be based on which part of the pelvic bone it is. So first of all, it's going to be connecting the ilium to the femur. So this is going to be the iliofemoral ligament right here. So iliofemoral ligament. And then we have connection between the pubis and the femur. So it's going to be the pubofemoral ligament. And then if we turn to the posterior portion, then we can see the ischium connection to the femur as well. And this is going to be the ischiofemoral ligament right here, as you guys can see. So those are the ligaments for you to be familiar with. Your lab manual also has the transverse acetabular ligament, which it will be around the acetabulum, this area right here, kind of around the acetabulum where it connects, where you have the acetabulum and you have the head of the femur. So that's going to be this area right here. And we talked about how the transverse acetabular ligament is going to be attached to the labrum as well, which is also going to be around the acetabulum. So yeah, that's the hip. Okay, so now we're going to be talking about the knee. So the knee is the larger joint that we have in our body, and it's also a compound joint, which means that it's going to be connecting not only the femur and the patella, but also the femur and the tibia together. So really, really important. So the first thing that we have here is the patellar tendon, right? And the patellar tendon is going to be connecting the tibia and the patella, right? And it's really interesting because even though it connects to different bones, it's called a tendon, but it's also called a ligament. So you can say patellar ligament or patellar tendon. So in addition to that, the knee has 5 different ligaments for us to be familiar with, and we're going to be starting talking about the collateral ligaments. So the knee has 2 collateral ligaments. One is going to be medial, and we know that it's medial because it's going to be the side of the tibia. And we know which one is lateral because it's going to be the side of the fibula right here. So if you look at the sides, we see how larger it is, this and thicker as well, this ligament right here in comparison to this one right here. So this one is going to be the medial collateral ligament, and this one is going to be the lateral collateral ligament. And they're going to be preventing our knee joint to move, forward. So it's going to be preventing both of our, tibia and fibula to be moving towards the sides. And in addition to that, we have 2 different bones that are the the 2 different ligaments that are the cruciate ligaments. We have the anterior cruciate ligament, and we also have the posterior cruciate ligament. So the anterior cruciate ligament, if we turn to the posterior portion of the femur, so I actually did not talk about this, right? So we know that this is going to be anterior because we see the patella, we see the femur, we have here the patellar groove, right? So we know that this part is going to be anterior. We also see the tibial tuberosity here, so we know that this is going to be anterior. If we turn posteriorly, then we can see the condyles, right? The condyles are always posterior, and we also have this fossa called the intercondylar fossa that is always posterior too. So we're talking about the anterior cruciate ligament and also the posterior cruciate ligament. So both of them are going to be coming from here. However, the difference is that this is going to be the posterior cruciate ligament. It's going to be from posterior to posterior, attaching to the tibia. So it attaches the femur and the tibia, intercondylar, fossa, and then the posterior portion of the tibia. And then if you think about the anterior cruciate ligament, which is your ACL, right, it's going to be coming from here. So coming from the intercondylar fossa, and it's going to be attaching to the front. Hope you guys can see it. Well, let's see what's better. It's going to be attaching towards the front of the tibia. So do you see here? This is the ACL, the anterior cruciate ligament right here, towards the front of the tibia. And then, in addition to that, we have one more ligament that's going to be, so again, this is going to be the posterior portion. Oh Lord, why am I moving so much? But anyways, here we have our meniscus, right? So towards the tibia side is going to be the medial meniscus, and then here we have the lateral meniscus. So we have a ligament in between them that is called the transverse ligament, right here in this area. You see? So that's pretty much it that we need to know about the knee. So hopefully you guys can see it really well. That's it. So now, alright guys, so now we have the ligaments of the ankle joint. So again, important for us to know what is lateral and what is medial. So here we have the two different bones, right, of our lower leg, and we have the tibia, right, and the fibula. So again, the tibia is always going to be medial, and then the fibula is always going to be lateral. That's what how we can tell that this side of the fibula and the pinky is going to be lateral, and then the side of the tibia and the big toe is going to be medial. So first things first, we can see really big here our Achilles tendon, right? It's going to come from the calcaneus bone up to the gastrocnemius muscle, and then the soleus muscle that we don't see here, but it's going to be here. Also important for us to see is going to be our plantar fascia. So it's going to be, again, everything kind of comes from the calcaneus. So the calcaneus is going to be the beginning of the plantar fascia, and then it's going to move towards our toes. So the plantar fascia here. Also important to know, so this is going to be the lateral portion, right? So we have something called the peroneus tendon. So that's going to be right here. We have two different peroneus tendons. We have the peroneus longus tendon and the peroneus brevis tendon. And those tendons are important because, again, they're going to be attaching to muscles that have the same names as the tendon. So it's going to be attached to the peroneus longus muscle right here that you cannot see, and then the peroneus brevis muscle that's going to be right here. So we're good with this. Now we can talk about ligaments, and I actually, so whenever we think about lateral ligaments, they are going to be connecting to the fibula. So we have the anterior talofibular ligament, which is going to be connecting the fibula to the talus bone, which is the bone right here below the tibia and the fibula. So you cannot see really well in this model, I believe, but it's going to be kind of here. Do you see right here? So it's going to be the tibia to the talus right here. It's kind of like a horizontal ligament. So this is going to be the anterior talofibular ligament. And then if you turn more to the back, then you can see that will be, oops, it will be right here. So this is going to be the posterior talus, you know, with the fibula. So posterior talofibular ligament. Yeah. And then we're going to have also the fibula with the calcaneus bone. So this is going to be the calcaneofibular ligament. And this one is going to be more, you know, a little bit more vertical. So I hope you guys can see it well here. We also have this model which may be a little bit easier to see or maybe not. So here we have the fibula. Oh, that's better. So the calcaneofibular fibular ligament right here. And then we have the anterior talofibular ligament. Yeah, we actually don't. But, well, it will be, so we have the talus here, and we have the fibula here, so it will be kind of like a horizontal ligament in this area. And then if you do posteriorly, then that's it. So we kind of have it here too. So the fibula, and then the talus. Okay, so those are the lateral ligaments. We also have two different ligaments that are the anterior inferior tibiofibular, that actually this is going to be easier. So it's going to be right here. So it's a ligament between the tibia and the fibula. So the anterior inferior tibiofibular ligament, and then if you turn the back, also here, fibula and tibia, we're going to have the posterior inferior tibiofibular ligament right here. And then lastly, if we look at the medial portion, so whenever looking at the feet from the medial portion, because we see the tibia here, we have the deltoid ligament, which is going to be this whole thing right here. So the deltoid ligament is going to be important because it's going to be composed by 4 different other ligaments. So the deltoid ligament is going to be always medial, and it's going to be composed by the anterior and the posterior tibiotalar ligaments. So it's going to be connecting the tibia and the talus bone that you cannot see it really well, but it's going to be somewhere here. And then you're going to have anterior, and then you're going to have posterior. Then you guys are going to have the tibiocalcaneal ligament as well, with the tibia and the calcaneus. The tibionavicular, which is going to be the tibia with the navicular bone. And then that's it. So that's pretty much it. You don't need to know specifically each one of the bones. I just think it's really interesting to have an idea of them, so you can understand that the deltoid ligament is going to be this whole thing right here. So yeah, we are good with the ankle joint. Alright guys, so now very quickly we have the elbow joint right here, and we only have 2 ligaments to talk about. So the first one is going to be the radial collateral ligament, which is going to be right here in the side, in the radial side, so towards the lateral portion from the anatomical position. And then this one is going to be the ulnar collateral ligament right here, which is going to be towards the medial portion in the ulnar side. Hopefully you guys can see it here. So one is radial collateral ligament, and the other one is going to be the ulnar collateral ligament. And in the same way that we have those ligaments in the elbow, we're going to have them in the wrist as well. Actually, not in the wrist, but we're going to have them in the phalanges. So I will try to show you again. Okay guys, so hopefully you guys can see this is the hand is still supinated, so the palm is facing forward and facing up actually. So just like we talked about the collateral ligaments in the elbow, we also have the radial collateral ligament right here. So we know that the radius is going to be towards the side, which because it's medial. So the radial collateral ligaments are going to be towards the sides of the phalanges, or the phalanx, right? So each one of the phalanges are going to have the radial collateral ligament and the ulnar collateral ligament. So the ulnar collateral ligament is always going to be medial because the ulnar is medial. So ulnar collateral ligament in between the phalanges here, here the same way, and here the same way, and then we have the radial collateral ligament right here in the same way. So hopefully that makes sense. We also have pictures of that in the model package if you have any questions, but mainly it's like towards the sides of the phalanges to make sure that there is stability around them. So the radial collateral ligament and then the ulnar collateral ligament, and this in each one of the phalanges towards the sides. And then we have the last ligament, which is going to be the retinaculum ligament. It's going to be right here towards your wrist. And it's really important because, of course, it's going to be protecting the carpal bones, but more than this is where your medial nerve is going to be passing through, which is going to be innervating your fingers right here. So yes, thank you so much for watching. That was it for today. Let me know if you guys have any questions, and I hope you have a great rest of your day. Bye bye.